I do want to start with the news that just broke this afternoon, an agreement with provinces and territories that will see the feds give them $19 billion in support for COVID-19, $5 billion more dollars than Ottawa initially agreed to. There are conditions, however, to how that money is spent. The CBC's David Cochran joins us from the newsroom to break it all down for us. Let's start off, David, with the agreement. What areas does it cover? What does it really mean for people who are watching right now and worried about the reopening of the economies, the loosening of restrictions, all of that?
Yeah, it's a big pile of money, Vashti, that covers a lot of areas, and it's bigger than have been negotiated earlier. But the ambitions of this are really to deal with the safe reopening of society in the absence of a vaccine. So $19 billion from the federal government, about another $4 billion in matching requirements from the provinces and territories that will boost this whole thing up to $23 billion. And this is really only to cover 6 to 8 months. I'll just start walking through some of this. There's a lot of numbers. There's about $4 billion there from the federal government to boost testing and tracing, and they eventually want to build the capacity so that Canada is testing 200,000 people a day. There's $700 million in a boost to the health transfers, $500 million in money to deal right away with things like mental health, substance abuse, and homelessness, and then about $750 million to help protect vulnerable populations like seniors in long-term care. So there's obviously a lot of healthcare money here because there's a big health component to this. But as the Prime Minister said today, this is also an economic plan. Here's Justin Trudeau.
COVID-19 isn't just a health crisis, it's an economic crisis too. So when we talk about the recovery phase, it's not just about making sure we can detect, control, and prevent future outbreaks. It's also about helping people, businesses, and entire communities adjust to our new normal. Because until we find a vaccine, the daily threat of COVID-19 will not disappear.
So because of all of that uncertainty, some certainty being offered today for like municipalities, what this agreement does is the federal government is going to pick up about 50% of the operating costs of municipalities for the next 6 to 8 months. There's $2 billion from that, which looks like it has to be matched by provincial governments as well. So about $4 billion for the big cities and everything who've been asking for cash to cover a 6 to 8 month period, and $1.8 billion from the feds to be matched by the provinces to help transit. We've seen concerns about the TTC. We've seen concerns in Vancouver. So a lot of money there to help cover over some of these remaining big issues on the First Minister's table, as Vashti, as well as $600 million to expand childcare spaces by hiring more staff, and $1 billion to create a new income support program that will create up to 10 days of paid sick leave for people who currently don't have it. Remember, this was a big requirement by people like John Horgan, the Premier of British Columbia, and by the federal NDP in return for past support. So the government said they tried to achieve that. They have now achieved a version of that in this agreement with the provinces.
The negotiations after the Prime Minister originally announced this idea, the $14 billion, originally took a number of weeks. There was some haggling, and we spoke to many of the premiers over the conditions that might be imposed on the money when it transferred to the provinces. What's the update on those conditions, and is there any information out about what happens when the 6 to 8 months of funding, when this money runs out?
Yeah, so there's a couple of things there to look at. So there are still conditions in this, in that the money is broken up into silos, and the provinces have to spend it in those areas, though they have some flexibility of how they do it. Like there's $4.5 billion here to buy PPE. They can decide which PPE they want. There's $625 million there for childcare. Based on the system that exists in each province, they can decide how to deploy it, but that money has to go into those specific areas. There's also some obligations here on the provinces and the territories. They have to match the money for municipalities. They have to match the money for transit. The money will not go to the municipalities or the transit associations until the provincial grant has been delivered, so it can't displace existing money. They also have to agree to create these sick leave programs to allow people to have better job protection to take the sick leave in areas where they don't have sort of protection for people who are sick, because that's a patchwork right across the country. As for what happens in 6 to 8 months, because the money's going to run out, Vashti, we know that. The virus may not run out. I asked Deputy Prime Minister Chrystia Freeland about that today. Here's what she had to say.
No one can truthfully tell you that they know where Canada or the world will be in 6 to 8 months. And I don't think any of us want to pretend otherwise to Canadians. We are going to continue working with the provinces and territories. We're going to continue working with the municipalities.
So we'll see, but a promise that the federal government will be there. And Vashti, we should say There's some tensions always in the Federation, but things seem to be going okay right now when the Prime Minister, the Deputy Prime Minister and the Premiers get together and talk.
Premier Moe is, I think, standing by and ready to take our questions on the agreement reached with the federal government and announced this afternoon. Hi, Premier. Great to see you.
Great to see you, Vashi.
So the initial announcement was for $14 billion. We've checked in with you and other premiers since then. There was lots of back and forth over that number. When did it change from 14 to 19? And ultimately, what, from your perspective, convinced the federal government to up that number?
Well, there's a number of changes that occurred. One was, yes, the global number of 14 billion to 19 billion, but then two was the flexibility that was created within each of the envelopes that are there, so that provinces can really direct the dollars to addressing the challenges that we are facing, which are different from coast to coast to coast. We're a very diverse nation. I've always said that, and our challenges are different, whether it be healthcare related challenges that are being delivered at the provincial level, or whether it be challenges we have with reopening our respective economies. So there was much flexibility that was created within the envelopes, which is very important, as well as the global number did climb, which is also important. And I think it should be also acknowledged that this is a step in the right direction. It's the provinces that have been delivering the response to COVID-19. And that response the cost has been far in excess of $19 billion across this nation. But this goes a great way to acknowledging some of that existing cost that has already occurred and the cost that has yet to occur.
I'd like to drill down, if you don't mind, Premier, on the concept of flexibility, because I know from your comments, as well as those of other premiers, that was one of the primary concerns. You were hoping for additional flexibility. The Prime Minister got a lot of questions about that too, and he indicated that there are certain expectations of the way in which the money will be spent. They want it to be public. They want the public to be aware of how it goes, and it still is in those envelopes. That was the main concern, at least from what I had heard right off the start from the federal government. They want it to go to childcare / municipality / the other 7 envelopes. So what actually ended up changing with flexibility then?
There was a higher per capita ratio around personal protective equipment, for example, so that we're able to procure that as provinces, and many provinces have been procuring that and have signed into some longer term agreements to ensure that we have access to that personal protective equipment. So there was a very large increase in the per capita dispersal on personal protective equipment. On testing and contact tracing, we do that differently across this nation, and we just in Saskatchewan use a number of different types of tests. Depending on how far away we may be from the lab, we use some of the rapid testing cartridges and machines in the far north to enhance and expedite our turnaround. And what this does is really allows when the federal government is transferring some of these dollars to the provincial and territorial jurisdictions, it allows us that flexibility to address the challenges that we have. And for instance, we are all working as jurisdictions to increase our testing capacity across this nation. That's part of the discussion of this agreement. We need to have that capacity there should we need it this fall, if there is a second wave. So we are working very hard to do that. This doesn't cover that entire testing capacity increase that we are looking for, but it goes a long ways to acknowledging that we need to continue to head down that path, and it's appreciated. This investment is appreciated by all of the premiers, and I want to thank all of the premiers for the hard work that they put in over the course of the last number of months in getting to this place.
I should mention actually that you are the Premier of Saskatchewan, but you're also the chair of the Council of the Federation, and we're asking you these questions in that capacity. You talked about this being a starting point, Premier, and I'm wondering what kind of assurances you and other premiers have been provided with from the federal government about what happens after this period of 6 or so months.
Well, the Council of Federation has worked very collaboratively across party lines, I might add, with the 13 premiers, including myself, across this nation, to work quite closely with the Prime Minister and the Deputy Prime Minister on behalf of all Canadians in coming not only to this agreement, which I would categorize as a step in the right direction and an appreciated step. It's a large amount of money, but this fall we'll be coming back to the table as the Council of Federation to look at the Canada Health Transfer and to look at how our healthcare funding is how that partnership is, where it has been decades ago, where it is today, how it got to here, and where it needs to be in the future. And I think this COVID-19 pandemic has highlighted the need for sustainable healthcare transfers in this nation, and we'll be back at the table in this very same capacity of the Council of Federation Premiers to have that conversation then. And this is, I think, a step towards that acknowledgement that we do need to continue to work together so that we can deliver healthcare, not only in times of a pandemic, but to deliver healthcare to all Canadians across the nation sustainably for years and decades to come. That conversation will start this fall. We have assurances of that.
Okay. Pardon me. I do want to ask you as well about the state of the virus in your province, because today it's a new high for a single day number of cases in Saskatchewan, 42 additional cases of COVID-19. That's the highest, I think, the highest one-day increase the province has had since the pandemic began. How worried are you about that number?
Well, we're always concerned when we have an increase in the numbers. These numbers, the vast majority of them are in a particular area. We have that area not totally isolated, but we have our contact tracing crew in there, and we are working very closely with the individuals in that regional area. And this is the normal for the next number of months until such time we have a vaccine, is we are going to have these local and regionalized outbreaks, and we need to jump on them with the appropriate contact tracing and testing capacity, of which is being further addressed in this agreement between all of the provinces, the territories, and the federal government today, so that we can then identify everyone that does test positive, and then isolate them to ensure that they aren't spreading it, and stop that regional outbreak at the regional level, so it doesn't become a province-wide outbreak or worse yet, a nationwide outbreak. So these are concerning, but we do have the tools in place, and we've been through this a few times in Saskatchewan. Other provinces have as well, and this is an example of how the provinces are the front lines when it comes to addressing the COVID-19 virus, and how we are isolating that virus so that we are really limiting the chance of having a vast second wave, if you will, doing everything we can to keep any of these outbreaks at the very localized regional level.
You talk about the regional nature of it. In that vein, I know in the north you had set up some checkpoints in communities or restricted travel between regions. Is that something you're considering here?
We're always considering all, and what we do when we have these regional outbreaks is we work very hard and diligently with the local leadership that we have. We did that in the north with multiple meetings between multiple ministers and leaders throughout the north, and we worked with them as to what the best solutions were there to control the virus spread. Part of that was closing down certain communities for a period of time, restricting travel in and out. What we are doing in these particular communities isn't at that point just yet, but it's not to say that it wouldn't get there. But we are working with the local leadership in these communities as well. I know our Minister of Rural and Remote Health was on the phone all last night talking to dozens of community leaders and ensuring that we are coordinating our response from the provincial level right through to the local leadership level. So there are initiatives that are in place. We're not at the restricting travel yet. It's not to say that we wouldn't get there at some point, but we're not there yet. Well, we're working very closely with the local leadership.
Premier, before I let you go, I have an unrelated topic to ask you about. We were just discussing with the Power Panel. I'm sure you're familiar. Federally, the We Charity controversy is having a big impact. And I just wanted to ask you about something the opposition has been pressing for some answers on in your province. And that's specifically I just want to make sure I get the wording right here, a $260,000 non-competitive contract to promote well-being among kids in schools in Saskatchewan. That contract was initially discussed prior to you taking a trip with the We Charity in December of 2019. I know that you cleared that trip and you paid for it. You cleared it with the conflict of interest. I think commissioner is the right term. Correct me if I'm wrong. And you also paid for the trip yourself. Was it appropriate, though, for there to be conversations about this contract before and after the trip?
Well, when would those conversations take place? You're right. My wife and I did take a personal trip of which we paid for. With respect to the We Wellbeing contract, that there is no contract. The provincial government, the Ministry of Education, and the Ministry of Health are looking at is this one of the tools that we can use to help support and address mental health challenges that individuals may have, in particular in our K-12 school system. And when someone comes forward with an initiative like that, we're going to look at it. And other provinces have. There's 4 or 5 5 other provinces that already have this pilot program, beyond the pilot program, but are operating this particular program in their K-12 schools. So they're still looking at it. There's no contract that has come for a decision or anything at this point in time. But if it is a support that is useful for and deemed to have outcomes in our schools, those are exactly the things that we are going to look at. We also have a process in Saskatchewan where if a charity comes forward with an initiative such as this, we have a process where we put that initiative out to other charities. So if there is, or other organizations, so that if there is other interest to operate that, then we can have a competitive bid. And we did follow that due diligence in this process. So I don't know whether we'll be moving forward with that contract, but it is one that the Ministry of Education and Health have been considering. And whether we do, they'll make a decision in the days, months ahead.
If prior to making a decision that potential contract comes across your desk, are you considering recusing yourself from any kind of discussion around it?
Right. I have no conflict of interest. I cleared that. That's another large difference with what we've seen go on here. Is I didn't know if this particular charity had contracts with the government of Saskatchewan, so I checked that before I took and paid for a personal trip associated with the organization. There is no conflict of interest that I have with this decision, but if this decision does come forward, given all of the conversation around it, I would consider recusing myself in light of the fact that there is no conflict, but just due to the conversation that has occurred over the course of the last while.
Okay, Premier, I'll leave it there. Thank you for your time this evening. Appreciate it as always.
Yeah. Thanks so much, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.